Hey, welcome to the recap of the retirement neighborhood chat. My name is Mark Rogers. In this chat, we went ahead and discussed the healthcare costs that continue to rise for retirees. We do review the research. Come on in, take a listen as to how in the world retirement expenses associated with healthcare costs are climbing at a rapid pace. Here we go. All righty, so here we go. Let's add to the stage our piece of. Let's add to. We got to get ourselves set up to do something here if we're going to do anything here. Things have moved around on me here a little bit. Give me one moment here, and we're going to go to healthcare continues to rise. All righty, you able to see that, Claudia?
Yes.
All right. Very good. Very good. So this is a piece that comes out. It comes out every year or 2 years and is absolutely a fantastic piece of research. And I'd like to read it as we go down here. This is from Fidelity Research. Fidelity says a 65-year-old retiring today will face $165,000 in healthcare and medical expenses, more than twice the average American expects. Isn't that something?
Wow. That's a huge dollar amount right there. $165,000.
Yeah.
Healthcare and medical expenses.
It's highlighted in Fidelity's 23rd annual retiree health and care cost estimates reflects an increase of nearly 5% from 2023, as more than double the initial estimate from 2002. What Robert Kennedy says, is Senior Vice President of Workplace Consulting at Fidelity, healthcare costs are among the most unpredictable expenses, especially when it comes to retirement planning. And he continues, as we approach the fall, an open enrollment period for healthcare benefits is a great time for Americans to be proactive in their financial planning efforts, Kennedy said. The best time to plan for most healthcare costs is long before they come along. This is why proactive planning is so big. Interesting enough, Fidelity's approximation is based on individual enrolled in traditional Medicare, which includes Part A and B. By the way, Claudia, we can let everybody else know, we're going to talk more about this in September. We're going to start to dive into Medicare a little bit. But it says, as well as Part D, which covers prescription drugs. However, many nearing retirement may find the process of selecting Medicare coverage challenging, with 55% of respondents will be difficult to enroll in Medicare and half expecting to feel overwhelmed or confused when choosing their plans. Boy, oh boy, this is just, we just don't have enough money saved, a lot of us, to $165,000 in healthcare and medical expenses. This is something that we have got to be able to plan for, and so what I'm a big advocate of is building an income plan. This is what I do for folks. I build an income plan. It's very simple, very easy actually. It takes a lot of the hypothesis out of things, and in there we start to build in those healthcare expenses. Okay. And one of the things that is actually, I don't believe it's part of the research, because I've been following this Fidelity research for some time, is long-term care expenses, healthcare expenses in the home, healthcare expenses in a facility. And that is a huge, huge problem that comes along that is really sucking down people's retirement savings along the way. I know, Claudia, you're part of that. Your mom isn't necessarily all the way there, need all that care, but you're a caretaker.
Yes, I am. 24/7.
24/7, and
24/7, everything. Yeah.
We talk about this, because there's that emotional strain, right?
Emotional, physical. Yes.
And that is, there's no price tag about the emotional side of it and the physical side of it. And then I talk about the financial realm of things, and that's important as well. And, along these lines, Claudia, I just met with a client that I've had for She's been a long-term care policy owner of mine since '09, and I sat down at her kitchen table, and she had kids with her this time, and she has got a spectacular long-term care policy that's grown. And an interesting thing, Claudia, is the premiums are high, but interesting enough, the kids wanted 12 or 14 years ago, the kids all wanted to chip in. Check
Oh,
it out. They're chipping in on the premium.
oh, how nice. Wow.
Okay. Because
Yeah.
I sat there and I go, man, I mean, the premiums, the benefits huge. I mean, the
Yeah.
benefits beautiful, right? How
Wow.
in the world, and because I know their financial, how they will do it? Well, I don't know, it's 5 kids, 6 kids, and they're all chipping in,
Mhm.
pay for care for mom if and when she needs it. Now she's a very, very healthy late 70s gal. Okay. Get up and go. But they want to provide the best care for her. And so,
And they're wise in planning that. They're wise in planning this way because, that means that so at some point, if the mom is incapable of taking care of herself, then one of them would have to forego their quote career, their livelihood, so that they can take care of them, be there for her, like I am 24/7. And 4 years ago, that's what I've had to do. I've had to put everything on hold in on my end so that way I can be here and available for my mom. Now, I feel it's a blessing to me to be taking care of her. And I don't take it for granted one day, or I don't um I'm very happy to be able to take care of my mom. But what um I don't want to call it a sacrifice, but what a commitment. What a commitment it takes to be able to do something like this, and to be able to provide for your parent, and these children are obviously seeing the value of having this plan and wanting to chip in. If that's the best they can do right now,
I know.
for her. And as she will need care, they'll be able to afford someone to come in and provide that service so that they can continue to have their lives and while they're there supervising this process. But just like that article says, the plan begins long before
Yeah.
the expenses are needed, right? And
Yeah.
that's what we're here for. That's what you do. You help people to create a plan long before they're going to need it.
Right. No, it's absolutely a good thing. Yeah. So, you know, and that family, that mother with her children, she's got 5 children. 4 of them are boys. Okay,
Yeah.
4 of them are boys. One's a girl. Okay. Let me just be real clear about things. When it comes to healthcare in the family,
Yes. Yeah.
it ain't necessarily the boys.
That is absolutely correct.
Well, you got siblings and all that, so you feeling the responsibility on your shoulders. So,
Yes.
anyway, we encourage anybody. You can always jump on my calendar, markscalendar.com. There's 20 minutes out there. If you want to just jump on, you're welcome to jump on, chat about this type of topic or any other topic forever. But